Fight malaria, it's so serious. Clean up your area, roll back malaria. Fight malaria, it's so serious. Clean up your area, roll back malaria. Don't give them places, even chances to give a bye. Roll back malaria.
One fundamental thing that the president also did was to appeal to his colleague to send him a special malaria team.
I told them what my objective is, that I wanted to eradicate malaria in 5 years. And they looked at that and said, Mr. President, reduce malaria? Yes. Eradicate it? No. I said, what do you mean by no? You eradicated it in Cuba. He said, yes, Mr. President, Cuba is an island.
Cuando nosotros llegamos a la Gambia, el cuadro realmente es desastroso. Son los niños menores de 5 años y las mujeres embarazadas los que allí padecen esta enfermedad. La Gambia está atravesada por un río de extremo a extremo y estos son los mejores criaderos para los mosquitos, donde los mosquitos están en constante proliferación. Nosotros ayudamos conjuntamente con organizaciones como la Organización Mundial de la Salud, con la UNICEF.
The main strategies are early treatment of malaria cases, research into the development of resistance of the parasite to anti-malarial drugs, vector control, and prevention.
How we can prevent the malaria?
Malaria li force pour fanko sa place ndak na set bu place bi sété nga xam sa sanké.
This is the only country in Africa where the usage of malaria bed nets is more than 60%.
The people with malaria maybe have fever, headache, abdominal pain, chills. It's very, very important that people know or recognize all these signs and symptoms because malaria can kill very fast.
Fue una de las cosas en las cuales nosotros estuvimos trabajando intensamente en ese programa. Es decir, hacer un diagnóstico rápido, aunque fuera de probabilidad, y un tratamiento inmediato, cuyo propósito principal era evitar la muerte del paciente. Poder contar con un médico que esté dentro de la comunidad, que viva y participe en las actividades de la propia comunidad, eso es exitoso en cualquier programa de este tipo.
Malaria incidence in this country has drastically dropped. So also is the case fatality, that is the number of people dying of malaria.
WHO told us that our malaria control program is almost #1 in Africa.
This country has also realized a drop in the infant mortality rate.
If you are really interested in development, the alpha of it is health.
The question of personnel to deliver services is the key question.
Welcome back to Green Time. I'm host Don Fitz, and with me I have a guest who you might certainly know if you're used to watching St. Louis TV, who's Zaki Baruti with Universal African Peoples Organization. Zaki, I'm very glad that you could be on the show to talk about healthcare in Africa, especially Gambia, and what that has to do with Cuba.
Okay, thank you, Don. Yes, healthcare in Africa, and in particular Gambia, is a very important topic to discuss for the 21st century. But in terms of discussing it, I'd like to kind of provide some statistics to people so that they can get an overall view of what's taking place in Africa. First of all, Africa is a continent that's populated by over 1 billion people. And in particular, Gambia has a population of 1.7 million. And when we look at health...
It's on the west coast.
It's on the west coast. It borders the country of Senegal, right on the west coast of the Atlantic Ocean. And I've been there for a day or two in my visit to the neighboring country, Senegal. But again, going back to healthcare, one of the key components of understanding healthcare is we have to understand the whole question of life expectancy, because life expectancy is a measure of the overall quality of life in a particular country, and it summarizes the mortality for all ages. When we look at, and I'm using statistics that comes from the Central Intelligence Agency of this country that does a ranking of over 220 countries and territories throughout the world. And first of all, the country that has the highest mortality rate, where people live to the highest expectation of years, is Monaco, which is on the French coast of France, you know, in a real wealthy area. And the life expectancy there is 89.7. So people practically live to 90 years of age. And then I also wanted to interject the United States, which is at 78 years of age, with the black population, though, less than that at 73. Then if you compare, when we talk about Cuba, Cuba is only 1 year behind the United States at 77 years of life.
Well, that depends on the statistics, because different people report it, and what I've read has the United States and Cuba being neck and neck.
Okay, well,
we know it's
right,
but they're
very close.
Okay.
And also interesting in Africa, the healthcare life expectancy is broken along two lines: North Africa and Sub-Sahara. In North Africa, places like Libya had an life expectancy of 77 years, Morocco 75 years, Tunisia 75, Algeria 74, and then a little small island like Cape Verde at 70 years. But when you go to Sub-Sahara, it begins to drop dramatically. And that includes countries like Madagascar, which is at 63 years. And then if we focus on Gambia, it's only 63 years of age. And then it goes all the way down to the last country that has the least expectancy, and that's Angola at 38 years. So with
38 years, that's amazing.
Yeah, that is. So if we look at that in terms of and most of the countries in the last 50 rankings are in Sub-Sahara in terms of that 220 number. So something is graphically wrong. And then if we look at the major diseases that's impacting, say, and we use the example of Gambia, we will find that 7 major diseases that's impacting Gambia would include respiratory diseases such as tuberculosis, bronchitis, lung cancer, pneumonia. Then you have epidemic of malaria, a lot of death due to early childbirth and maternal deaths.
A lot of things that are preventable.
Absolutely.
In a good healthcare system, a lot of these people should live a lot longer.
Absolutely. And then you have the diseases such as cholera, dysentery, and typhoid, as well as strokes and heart diseases and HIV. So many of the causes can be preventable, as you mentioned. Some of the causes included contaminated water, contaminated food, unsanitary disposal of human waste, poor hygiene. But probably undergirding all of that is government response.
Yes.
And so to that end, to change the health conditions in Africa, that needs to be a whole different kind of outlook and proactive approach to dealing with the overall health care.
And one of the things the DVD says, you just can't replicate the Western system in Africa. It just doesn't work.
Absolutely. And in using the example of Gambia, which began a close association with Cuba, I think in the late 1990s. Or
1996.
1996. With Cuba, as I stated, their life expectancy being the same as close or the same as the United States, they began to set an example, because in Cuba, it had their whole approach to preventing diseases was to look at the entire community and using the approach of having people live among the people, I mean the doctors,
right,
to help solve some of the healthcare issues in the community.
So, okay, well, we just got about a minute and a half left, but you've covered a lot of territory there. One of the things which really impressed me about the DVD was when they said how much malaria, you know, when the Cuban doctors went in, they were able to decrease the malaria from something like 600,000 deaths in 2002 to a third of that, only 600,000 cases to 200,000 cases in 2004. And for a lot of the world, that's a really well-known figure.
Absolutely. And one other thing, Cuba had a great influence on the Gambia healthcare because it helped it develop 3 levels of healthcare, one being the primary level, where you had healthcare, village healthcare workers working among the various villages to provide outpatient care, community health education, and to make sure that those villages had essential medicines. And then you had what was called the secondary level, which had large and small health centers. They had 7 main government-run private health centers, 12 smaller ones, and 19 pharmacies throughout the country. And the last is the major one, where they had 4 major referral hospitals in Gambia.
Right, and when the movie says that when Cuba first came, they only had 2 hospitals, so Cuba was able to help them at least double that,
right,
to from 2 to 4. Well, listen, I want to thank you very much, Zaki, for coming, and I want to thank all of our viewers for listening to our discussion about healthcare, global healthcare, especially in Africa, and we hope that everybody has an opportunity to take a look at Green Time next time around.